Well, hey guys, happy Friday. I think this is our third Facebook Live. And my question that I'm going to address today is more along the lines of prevention. The question is, can I prevent X, Y, or Z pain? Can I prevent neck pain? Can I prevent shoulder pain? Can I prevent back pain? Very good question. And I would say the answer to that question is I believe very often the answer is yes. And the reason that is because we usually have signs that are present before symptoms start. And I'll explain what I mean. For those of you that kind of have heard me talk, you will have heard me say that I think your posture is related to quite possibly almost any pain that you might have. And I say that because it's true. Like, we cannot continue to use our body in repetitively poor postures and movement patterns and expect it to behave nicely. Hi Kiva, I'm glad you're here. Hi, thanks for saying hi. I'm glad you're able to hop on live. We're talking about prevention today on today's video. So make no mistake, you guys, your body is a machine, and machines often require regular maintenance and tune-ups. And just like with your car, sometimes, I don't know, ours is doing it now, where you hear this little like clicking happening from the back of the car and you're not quite sure what is causing it. You're not even sure if it's serious. It doesn't seem to be. The car's running okay, but what is this little clicking? Well, the clicking probably is a sign that something's going on in the vehicle that we should get addressed soon. Your body often presents little signs to you that something is going on. So how can you, where can you start, basically? Well, one of the most powerful tips I can give you is just keep moving, because movement is medicine, and we do tend to have better posture when we're moving. Not always, but we do tend to have better posture when we're moving. And so our body is a machine, and it craves movement and everything that comes from that, so just keep moving. The second tip that I would give you is really make a commitment to learn about what good posture is. And when I say that, I mean sitting posture, standing posture, and sleeping postures, because those are the three positions that we spend prolonged periods of time in, and those are the postures that are going to cause some of those changes to your machine, where we get tight and short in the front side of our body and stretched out and weak on the back side of our body, and then we try to stand up and be active, play with our kids, carry a laundry basket, go for a run, and everything is in this faulty posture. So the second tip would be to make a concerted effort to learn about good posture. If you need resources for that, I've written a couple different articles and by way of blog posts that you can find on, well, they'll be in this group ultimately, but also on my website. And then the third tip I would have is just kind of every so often check your motion. What I tell my patients, I often tell my back patients this, but it goes for any body part. You should have full and pain-free range of motion of every joint. So take yourself through a head-to-toe assessment, especially when there's no pain, right? So your head should fully go forward and it should fully extend backwards. Your neck should fully turn to the left and to the right. It should side bend to both sides and should slide forward and backward. Your shoulders should go through all available motion forward and to the side. It should reach behind this way. It should reach behind this way. And you should be able to reach around this way. Your low back should be able to fully bend forward and backwards. Your hips and knees, all of the joints of your body should be able to move through the full range of motion that you have. If you have limitation, like you'll notice, so that's often a sign that something isn't moving right in my body, and oftentimes the signs are the limited range of motion or the faulty movement patterns. And if we identify them early enough and correct them like a tune-up, then we can prevent the overuse injuries like a rotator cuff issue or pain on the side of the hip or neck and back pain. So one of the things that I like to do when I have a patient in my office is I look at a few different screening tests, basically, the first of which is literally just their posture and how do they line up to gravity, their head over their shoulders, over their hips, and etc. That where is the shoulder positioned, in relation to, in the shoulder socket. So posture can tell me a lot about the signs that you might have that something's going on. And then there's a couple movement tests that I like to do, not just taking the joints of the body through their available motion, but what does it look like when you do a squat? Can you keep your knees in line over your toes? Do your hips shift back? Does your chest fall too far forward? Can you stand on one leg? Can you balance on one leg and hold your pelvis level? And if you can't, then you have weakness on the side of your hip, and you're very possibly capable, at risk for developing some hip pain, especially if you're trying to walk a bunch or run. What happens when you lower yourself down, like stepping down off a step? Do you have good alignment in your foot and ankle, at your knee? Does your knee cave in? So by looking at your movement patterns, we can see signs of faulty movement that indicate weakness or tightness or stretched out. We can see things that would be very, very valuable and preventative at preventing pain from starting if you're aware of your movement disorders and your loss of range of motion and your weaknesses before they start. So those are kind of my top 3 tips, basically, for how to prevent pain, and just my 2 cents and professional opinion that having somebody take a look at your posture and your movement patterns are a very valuable way to prevent pain. And if you don't have regular tune-ups for your car, it's going to break down, and that very same analogy can be applied to your body. So thank you guys so much for watching. That's my live video Q&A for today. Kiva, since you're here, if you have any questions, I'd be happy to stay on for a moment or two and answer them while you're here. If not, if you guys found this valuable, will you please let me know? You can comment below the video that you've caught it on a replay. As always, if you have any questions yourself, you guys come in here and ask them either Wednesday ahead of time in the post that goes up on Wednesday, or catch me live at noon on Fridays. And I'd be happy to be there for you. My hope is to be the go-to person and the person that you ask when pain or injury strikes. And I just want to thank you for helping me, to spread my mission of helping active people overcome their pain and injury so that they can get back to doing what they love. Awesome. Thank you so much, Kiva. Well, you do, and you are, and I know you value prevention. So I'm glad you found it valuable. Thank you for watching. I hope everybody has a fabulous weekend, and I will talk to you next week for sure, but if not, sooner in the group. Okay, bye everybody. Thank you. Absolutely.